Today, there are many diverse methods of artificial method birth control available on the worldwide market. The most commonly used method still comes in pills from may suppress ovulation, may impede sperm migration, may inhibit implantation. Oral contraceptive. The combined oral contraceptive pill, often referred to as the birth control pill or colloquially as the pills, is the type of birth control that is designed to be taken orally by women. Transdermal patch. A transdermal patch is a patch that attaches to your skin and contains medications. The drugs from the patch is absorbed into your body over a period of time. Vaginal ring. The vaginal ring, Nuva ring, is a small, soft, plastic ring that you place inside your vagina. Subdermal implants. Subdermal contraceptive implants involve the delivery of estrogen, progestin from polymer capsules or rods placed under the skin. Hormonal injection. The contraceptive injection prevents pregnancy by injecting a synthesis versions of the hormones progestogen, called medroxyprogesterone acetate, or DMPA. Intrauterine devices. An intrauterine device is also known as intrauterine contraceptive device or COL, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. Chemical barriers. Chemical barrier against infection include enzymes in tears, saliva and mucose that break down the surface of bacteria. The diaphragm is the barrier method of birth control. It's moderately effective with a 1-year failure rate of around 12% with typical use. It is placed over the cervix with spermicide before sex and left in place for at least 6 hours after sex. Cervical cap. Between cervical cap and the diaphragm, because they both work spermicide and cover your cervix to prevent pregnancy. However, cervical cap are smaller and shapes differently than diaphragm. While diaphragm are shaped like a bowl, and cervical caps look like a sailor hat. Male condoms and female condoms. The male condoms is more effective than the female condoms at preventing pregnancy. This is probably because it is easier to place on the erect penis rather than inserting a female condoms into the vagina and ensuring that the inner ring hits the cervix. Natural method. Natural methods of birth control do not involve medications or devices to prevent pregnancy, but rather rely on behavioral practices or making observations about a woman's body and menstrual cycle. Abstinence. Calendar method. The calendar method can only predict what are most likely to be safe and unsafe days. It can't tell you for sure exactly when you're fertile, so it's hard to use if your cycles are not always the same length, and you can't use it at all if all of your cycles are shorter than 27 days. The cervical mucus method is a type of natural family planning, also called the Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. There are several ways to detect ovulation, including urine test kits to measure LH levels, transvaginal ultrasound, endometrial biopsy, blood tests to measure hormone levels, and the basal body temperature BBT chart. Coitus interruptus is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates.